So, Dr. Evans, to someone that's never heard about it before, maybe but has been first diagnosed, what is pancreatic cancer?
Sure. Well, pancreatic cancer the pancreas has two functions. It has an exocrine function where it makes digestive enzymes to help digest the food. And it has an endocrine function to help produce hormones, the most common being insulin. Insulin obviously controls our blood sugar. The pancreas makes a number of other hormones involved in intestinal physiology and various other things. In any event, you can develop cancer of both the hormone-producing cells and the enzyme-producing cells. So a cancer of the enzyme-producing cells, or the duct cells, is the typical type of pancreatic cancer that is right now in Wisconsin the second leading cause of adult cancer death. And we think probably throughout the United States will soon become the second leading cause of adult cancer death behind only lung cancer. Unlike lung cancer, where 80% of lung cancer is still tobacco related, important that 20% is unrelated to tobacco use. With pancreatic cancer, the majority of patients who develop pancreatic cancer develop it for no reason. There has been no, no antecedent cause. So the pancreas has an exocrine function, which produces digestive enzymes. The common type of pancreas cancer is a cancer of the enzyme processing cells, the duct cell. And then it can also produce hormones. And a cancer of the hormone producing cell, or the islet cell, is a pancreatic neuroendocrine tumor. They are oftentimes much more indolent. They grow, and the non-medical term for indolent is to grow much more slowly. In fact, the tiny little pancreatic endocrine tumors that we diagnose, oftentimes we simply observe them. Going back to what causes the typical type of pancreas cancer, a small percentage of patients have what we call the Patrick Swayze phenotype. They started smoking probably when they were teenagers, have very heavy tobacco use, and that probably plays a role in them acquiring pancreatic cancer. Pancreatic cancer can be also a tobacco-related malignancy. A very tiny percentage of patients have what I term the Luciano Pavarotti phenotype of pancreas cancer, and it's related to diet and obesity. Again, that's a very tiny percentage. And then a small percentage of patients may have a genetic predisposition, either within their family, and oftentimes that is associated with a gene that we haven't yet discovered. So pancreatic cancer may present very rarely within serial generations of a family. And we typically associate that with a family that has had, with a patient that has had at least two relatives, first generation relatives who have pancreas cancer. So very, very rare that we have a clustering within a family and there is not an obvious genetic mutation. And then there are patients who have known mutations in a few select genes, again, very rare. Probably the most common is the group of breast cancer predisposing genes, or the so-called BRCA or BRCA genes. And that, excuse me, fighting off a few sniffles here, but it's not COVID. And the BRCA genes is probably the most common, and there are a few others that are very rare. But while we in medicine spend a great deal of time looking at genetic predisposition, the vast majority of patients, the overwhelming majority, probably at least 80 to 90% of patients, have pancreatic cancer for no obvious reason. And they all tend to be really nice people. And that's why we're working so hard at this disease. But there is not an obvious predisposition. And that's why finding a blood test or a marker of early diagnosis is so important. The one finding that we have now is clearly when someone develops the early stages of pancreatic cancer, and this is a cancer of the exocrine pancreas, or the enzyme processing cell. When one develops a cancer, a typical pancreatic cancer, they usually have a decrease in insulin production and a slight increase in insulin resistance in the body. So oftentimes the blood sugar goes up at a time when their weight may go down, a very sensitive indicator of a possible pancreatic cancer. So it's important that physicians and potentially people know that normally when you're an older adult and you get and your blood sugar goes up, it usually is accompanied by a gain in weight. So the weight and the blood sugar move in the same direction. They move up together. If, however, the weight goes down and the blood sugar goes up, that is an indication for a CT scan of the abdomen and a further evaluation of the pancreas. And this is becoming more widely known. I've seen a patient this month, and I saw a patient last month who was diagnosed by their family physician because of a change in blood sugar at a time when their body weight was not going up.